Healthcare? Ano daw? Yes, karamihan ng ating mga kababayan ngayon don't know about healthcare. Kaya, a lot of Filipino pinipili na lang mamatay kaysa magpa-hospital because napakamahal magkasakit. In this video, I'm gonna explain to you the things you need to know about healthcare. So, we're gonna divide it into 4 parts. So for the first one, this will be the video flow. So the first topic is, what is a healthcare? Second, why do we need a healthcare? Third, what are the types of healthcare? Fourth, tests of a good healthcare. So, what is a healthcare? So healthcare, guys, is anything that maintains or improves your health condition. It is usually done by medical professionals or allied medical fields. Next, why do we need
a healthcare? We need a healthcare because our body is like an ATM machine. Pag nasira ba yung ATM machine, may lalabas na pera? Wala. Kaya, kailangan natin itong ipa-repair sa mechanic. So, since di naman tayo machine, we need doctors to help us recover. If we have a healthcare, ganito yung buhay natin. Without healthcare, ganito yung buhay natin. Wherein, yung death rate ng mga public hospital compared to private hospital is very, very high.
Why you need to have a healthcare, especially if you are a breadwinner of the family. You don't want to be a broken ATM machine, right? That is why you need to know the different types of healthcare. So what are the different types of healthcare? So actually, there are 3 types of healthcare. First, the short-term, the senior care, third but not the least, the long-term care. So what is a short-term healthcare?
Short-term healthcare is given to you by your employee during your productive days. It means, pag nagkasakit ka, the healthcare company will shoulder your expenses. But the catch is, if you don't use it, you lose it. What do you mean? Pag nagkasakit ka and ginamit mo, you don't lose it. Pero pag di ka nagasakit, di mo ginamit, you need to renew next year. But renewal is not guaranteed if you have high claims. Paminsan-minsan naman, tinatasan nila depende sa iyong edad at history. But worry not because it will be shouldered by the company itself, especially if very productive ka. But if you reach the retirement age, you will lose it. It means goodbye free HMO.
It is quite saddening, right? Like, when we retire and get old, our free HMO is also gone. It is sad in a way na we already know that at that certain period, dun yung aabot yung mga sakit. Tulad ng diabetes, arthritis, at marami pang iba. So that is why we're gonna explain what is a
senior healthcare. A healthcare na kailangan mong kunin pag retiro mo or at age 60. Ito yung klase ng healthcare na papalit sa HMO mo na nawala during your retirement days. So, ang catch lang nito, this healthcare is expensive. Expensive? Magkano ba? Usually, ang price nito ranges from 31 pesos and above. Plus, renewal is not guaranteed. It means kung malaki yung claims mo, may possibility na hindi mo na marirenew yan next year o kaya mamahalan nila. Next, pre-existing condition is not covered. What does it mean? It means that if you have diabetes, hypertension, arthritis, before you apply with healthcare like senior care, hindi na siya i-covered ng insurance company. It means you're all by yourself. And lahat ng bill ng hospital will be on.
It's quite disappointing, right? Mahal na nga yung premium, hindi pa covered pati yung pre-existing illnesses. Pero, we also need to bear in mind na insurance is also a business. It means that, kung malugi sila, automatically mawawala rin yung health insurance mo. Kaya, you need to know about the third type, like health insurance, which will cover pati yung pre-existing illnesses mo after you retire. But before that, you need to subscribe and click the bell button if you enjoy my video and share it with your friends. So the third type of health insurance will be the long-term care.
Long-term healthcare. Long-term healthcare is a combination of short-term healthcare plus senior care. It means, pag nagtatrabaho ka at nawalan ka ng trabaho due to pandemic, ibig sabihin, magagamit mo siya. As long as nabayaran mo na siya for 7 years or wala kang lapses. Plus, if nag-retire ka na, unproductive ka na, magagamit mo siya as long as may fund ka pang natitira. Ang kagandahan ng klaseng healthcare na ito, 7 years mo lang siya babayaran. 13 years ka na mag-wait for it to mature. So that's why you need to pay it as soon as possible. Kasi itong klaseng healthcare na ito is also an investment. Ibig sabihin, tutubo siya. And the longer you put your money on that investment or that your long-term healthcare, lalaki yung value. Instead of $500,000 after maturity period, may possibility if 14 years mo siyang kinip at store dyan, magiging 3 million mo siya. Ibig sabihin, mas malaki yung fund mo for your health just in case nagkasakit ka. Ibig sabihin, hindi ka magiging pabigat sa pamilya mo. Pero what if nagkasakit po ako at namatay? Good news, may life insurance siya. It means, pag namatay ka, may makukuha yung family mo. At kagandahan pa ito, even though di mo siya fully paid, it will be automatically transferred to the person or your beneficiary. Fully paid. Maghihintay na lang sila sa maturity period. Diba maganda? So that's why, get your long-term healthcare right now and don't wait na mag-60 ka at di ka na pwedeng kumuha ng long-term healthcare.
Ngayon, natapos na tayong mag-discuss sa tatlong uri ng healthcare, which is the short-term, the senior care, at the long-term care. Let us now discuss how to figure out if a long-term healthcare is a good. So, may test tayo dyan. So, for the first one,
it needs to have a short-term healthcare. Ibig sabihin, magagamit mo siya kahit di ka pa matanda. Next, magagamit mo siya even after you retire. Third, may life insurance siya. Apat, your money grows pag di mo siya gagamitin. If meron tong apat na ito, get that healthcare. So, uunahan ko na kayo. I'll give you reason why not get a healthcare. So, you don't need to get a healthcare if, first, you're sure that you're never going to get sick. If you think you can bring your company's HMO even after you retire. Third, if you think the government can take care of your healthcare needs. Fourth, if you expect your children to take care of you. Kung gusto mong pabigat sa mga anak mo in the future, don't get a healthcare. Remember, the comfort level of your healthcare situation after the age of 60 depends on the decision you make today.
A lot of you might say, don't you worry, I have already it covered. Yes, you have already it covered. Pero tanong ko, ano? Maybe yung sagot mo, may PhilHealth ka na. Yes, that is very, very good to get a PhilHealth. Pero, alam nyo ba, na 15 to 20% lang ang covered ng PhilHealth. And according to the World Health Organization, 48% ng total bills sa hospital are covered by your own pocket. Ibig sabihin, if yung bill mo sa hospital, 100,000, 480,000 yung i-covered mo. Why? Because in PhilHealth, even nasa private ka or public hospital, even in public hospital, it's greater than 15 to 20%, may tendency na may excess. Yung excess is napakalaki for majority of Filipino living in the Philippines. Kaya, if you don't get your healthcare, get it right now. Because, karamihan ng mga Pilipino ngayon, pinipili na lang nilang huwag isugod sa ospital at mamatay kasi napakamahal magkasakit. Yes, it is very expensive to get sick. That is why you should consider to get your long-term healthcare. Just get it. Kasi it is for your own good and for your own family. Remember, marami ng taong pumunta sa hospital mayaman. Paglabas, mahirap. Papaano na lang tayo na di naman mayaman, paglabas siguro, mas mahirap pa sa daga. To end this video, if you want to know more about my healthcare or anything you want to ask, if may mga question kayo or violent reaction, just comment down in the comment section. That would be all for my video. Thank you for watching.